the family welfare or the fertility regulation program that strongly advocated limiting size of the family. Some critics say that legalizing abortions was a calculated strategy to combat the country's spiraling population. Demographers have found that small families work against girls. In a society like India, son preference within a small family also means that some daughters would have to disappear. Public health activists claim that wrong priorities of the family planning policies and the vested interests of certain sections have led to such a grim situation.
You know, this is very true. In 1960, for the first time, government took up, the government means central government took up the issue of the need for population control. You can call it population stability, population control, small family, two-child family, etc., etc. But that was when it started, and a huge program was launched across the length and breadth of the country by the Ministry of Health, by whatever it was called. I think it was called health or family welfare, that doesn't matter. It was launched by them and by the state departments of health, corresponding states. But they looked at the numbers. We have to cut down the population because food resources are being decimated by the growth of population. The death rate is falling. The death rate is falling, but the birth rates are not falling. So the result is a huge burgeoning population, and therefore the rationale for the population program, which in various ways and with various changes is still there. Various ways and various changes. I am not saying the same program is still there. The basic fault or the basic lack of imagination at that time was that if you are thinking of a small family is all right, small is not precise. But finally it came to a two-child, wrongly. And I have to say here that this is also a wrong interpretation, because if you look at the national national population policy, which was passed in, approved and notified in 2000 or 2001. There is only the mention of a small family. A two-child number is not there. Small could mean 3. Small could even mean 4. But it has to be a planned family. So, but it became, due to various reasons, I am not going into that, into a two-child now. Now, if you have 2 children only, if you are allowed to have 2 children, and if you keep certain government benefits only for people who adopt a small family or a two-child family, what will happen? Supposing the first 2 are girls, it could well be. So unless you carried on a gender sensitization program right from 1960 downwards, right to today, this was bound to happen.
The central and state governments in the country have set up central and state level supervisory boards and advisory committees to advise the authorities from time to time, and the responsibility to implement the act has been given to appropriate authorities in each district of the state.
जितने भी सोनोग्राफी सेंटर्स हैं उन सबको कानून के दायरे में लाना बहुत ही आवश्यक है, और नियमित रूप से उनकी जो मॉनिटरिंग है वो करनी काफ़ी आवश्यक है। और साथ ही जो समुचित प्राधिकारी है वो क्या करते हैं कि वो अपनी उनको जो एक जिम्मेदारी दी गई इस कानून के क्रियान्वयन की, वो जिम्मेदारी वो अपने जो दूसरे अधिकारी हैं, जो उनके नीचे के अधिकारी हैं, उनको दे देते हैं, जिनको समझ होती ही नहीं है कि इस कानून का क्रियान्वयन किस तरह करना चाहिए। ख़ास तौर से उन समुचित प्राधिकारियों को जो अभी जिला स्तर पे कलेक्टर है, तो उनको उस कानून के क्रियान्वयन के लिए काफ़ी को ही उत्तरदायी बनाया जाना चाहिए। उन्हें ही मतलब इस कानून को क्रियान्वयन को करना चाहिए।
It has often been found that the appropriate authorities, either the chief medical officers or the district magistrates, are burdened with 100 other responsibilities, and they cannot devote any time or attention to regulate the ultrasound clinics, Additionally, complaints against medical practitioners are often not entertained, as the appropriate authorities themselves belong to the medical fraternity.
I know a state, and I know more than one state, where every doctor working in the government knows who owns the clinic, illegal clinic, which does sex-selective abortion. Every government doctor knows. I am not going to mention the state. So it's very easy for them to absolutely, catch him when he's doing it. They won't do it. They won't do it. And I am blaming that on a so-called professional bonding, because those are all private doctors, and people in the government are all government doctors. But there is a professional bonding between the two. They will never, there may be cases where they do, but in majority of the cases, the doctors themselves will not like to name the private doctors who are running the clinics. So where are we? I mean, when the very instruments of implementation of the act have gone rusty, and it's only the civil society groups which are running here and there and trying to influence politicians who are too busy with with so many other things to give, and the politicians are also there. They can also ask the doctors, their own government doctors, to tell them who are the persons who are doing this illegal abortion, who are the private doctors. It is not a question of lack of knowledge, it's only a question of lack of will, and it's only a question of lack of, as I said, political priority. Dead girl children are not a political priority.
In order to strengthen the understanding of PCPNDT Act and other gender-related legislations and judgments in the country, the United Nations Fund for Population India, in collaboration with Law University Jodhpur and PCPNDT Cell, launched a training initiative for the young practicing lawyers in Rajasthan. The objective was to make lawyers as catalysts in the society to facilitate the implementation of the Act.
We have found that there is a gap in terms of understanding the PCPNDT Act and also other gender-related legislations. This is, as I have earlier said, in the curriculum also, this is also a new act, and in the curriculum also there is no much focus on